In this demo, we are going to look at how you can report the APP for an ACO within the QPP program. To start, we're going to go to qpp.cms.gov and enter our information associated with our HARP account. We have our user ID and password, and then from there, we're going to have to attest to the statement of truth. Once we click sign in and have been authorized, we are going to land on our homepage, which then shows us that the submission reporting window is now open and we have the ability to report. Once we click on Start Reporting, we're going to evaluate our APM entities. Underneath of this user, we have two different APM entities that we're looking at. If I click on Start Reporting, you can see that we are then guided to the reporting options page. On this page, we have the ability to either one, report through the APP, or two, report via traditional MIPS. Both of these options are then available through the Start Reporting button. Once I click on Start Reporting, since the entity we are evaluating is associated with the Shared Savings Program, this entity is required to report the APP to meet the requirements of the Shared Savings Program. On this page, you can see that we have the ability to scroll down and view the information associated with each one of the categories. We have full credit for improvement activities, that's auto credit assigned. There has been no data associated with PI. This won't be available until after the submission period ends, and it will be associated with all of your participants that the score will be rolled up and then assigned down. For the quality category, you have the ability to then go view and edit. On this page, you can see that you have the available options of either one, manually uploading data, two, using the CMS web interface, or three, if you're working through a third-party agency that is responsible for reporting your data, that you would want to contact them to alert them that no data has been submitted. Any type of CMS web interface submission for the ACO within the Shared Savings Program will only be applied to APP reporting and is not eligible for any type of traditional MIPS reporting. If you are uploading a file associated with APP, you are going to need to report the three required measures for the APP, which are Measure 1, 134, and 236. And then additionally, as shared savings programs do have the multiple chronic conditions measure that would be applied at the ACO level, this measure will be available once the submission period closes. In addition to the MCC, they would also be required to register and successfully participate within the CAP survey, and if meeting all of the thresholds for the hospital-wide readmission measure, this would then be applied post-submission. During the submission period, you will see only the three measures that you've submitted, as well as a placeholder for the three additional measures that may be applied after the submission closes. If using the CMS web interface, you'll see updates once the information has been completed, and you'll be able to view your score. And in addition, the three measures that apply after the submission period closes for the ECQM or CQM version would also be applied on top of the CMS web interface score. This concludes the demo for APP reporting for Shared Savings Program ACOs within the QPP platform.